Hello all. Today's video I'll be focusing on understanding total knee replacement from the patient's point of view. So I'm Dr. Aditya Kekatpure. I'm an orthopedic surgeon practicing in Nagpur. So today's video I'll be discussing the key aspects of total knee replacement, a basic thing regarding what implant is used commonly in knee replacement, and then what you can expect after the knee replacement surgery. So let us go ahead. Let us understand what is a knee joint. So a knee joint on this model you can see there is upper bone that is femur, lower bone that is tibia, okay, and this is how the movement occurs in the knee joint. And this gray thing that you can see mimics the cartilage. So cartilage is basically a thin layer covering our two bones, so it is present all over the body around the joints, and cartilage is not supplied by nerves, and it basically acts as a lubricant. It does not allow our bones to rub against each other. So whenever the cartilage is gone, what happens, the underlying bone is exposed, and that is where the nerve endings are. And once that is gone, the patient complains of pain. Now you can see in this slide, you can see a healthy cartilage on the left side, that is a healthy knee joint, and you on the advanced osteoarthritis you can see the cartilage is gone and you can see lesions over there, and that is when the normally the joint space is there and that gets lost, and then the patient starts experiencing pain. So when do we require a total knee replacement? So whenever the patient has severe knee pain on doing normal activities like walking, going for a walk, doing daily activities, and when no orthopedic surgeon will directly recommend to go ahead with the surgery unless and until you are in a very advanced stage of knee osteoarthritis. Initially, everyone recommends a medical treatment that includes some painkillers, some intra-articular injections can be given, and along with that, we will recommend you some physiotherapy. We do this for 6 to 8 weeks and we see how much improvement is there in your pain. But if it is not, you are not responding to all this, then you are a good candidate for total knee replacement surgery. And also, whenever a joint gets eroded, the movement at the joint, the movement at the joint gets reduced. Okay, and this is also an indication for total knee replacement surgery. So, what basically is done in total knee replacement surgery? Because this question every patient asks me, sir, what is done exactly? What you are doing over there? So now, basically, what we are doing is that we are taking out the eroded cartilage that is there. We take it out and we replace it with the same thickness implant. Now, I have bought some implants for you. So now this is the implant that this we call as a femoral component. This is a tibial component, okay, and then in between the two components we insert a high quality plastic. So this now acts as your new joint, okay. So this is what is replaced on the existing bone, like this, okay. So, basic about operation. So, whenever you are planned for a surgery, you will be taken to an operation theater. You will be given an anesthesia. It can be regional anesthesia or it can be a general anesthesia depending on your medical condition. The limb is cleaned and then we go ahead with the surgery. So, what to expect in the post-operative period? Your surgeon will be giving you some painkillers for a couple of days, and along with that, some antibiotics. You will be asked to mobilize the next day once you are comfortable and out of your anesthesia, and then gradually a physiotherapist will be called upon to start range of motions and other exercises on your operated side. So this is how the normal recovery goes. So, what is the recovery and benefit of the surgery? So, once you undergo surgery, and unless and until there are some complications, you will have improved mobility, and the pain that you were having because of arthritis will definitely go. So, life after surgery and follow up. So, what are the tips for maintaining the joint? So, basically, what I tell all my patients is getting a knee replacement surgery is like getting married. Okay, so you have to take care of your joint. You can do all the activities that you wish for, but definitely it is better to engage in a low impact activities like walking and gardening. we discourage patients to go for running and jogging or high impact activities, because you can do that definitely, but that puts lot of stress on your artificial joint. So definitely you need to adjust your lifestyle to protect the new joint, like your what to say, your newly wide spouse. Yeah. And what are the possible risks of this surgery? Now, unfortunately, no surgery comes with zero risk. Any operation has its risk and limitations, and which you have to accept before going undergoing surgery. So your surgeon will be discussing all this risk with you. Some of the risks that are common with this surgery are infection. You may require blood transfusion if there is significant blood loss. Sometimes there can be clots in your veins of your legs, which can be taken care by some medicines. So I'll quickly share one case example. Now, this is a 78-year-old lady with significant reduction in the joint space that I showed you previously. And this is what we did for her. These are the post-operative X-rays. She is comfortable. She's walking around. She's able to do all the activities that she wished for, right? And so, age is not a barrier for undergoing the surgery. Rather, this surgery is required when you are 60 plus, because that is when your joint will start complaining a lot. Younger age group might be because of inflammatory arthritis like rheumatoid arthritis. They may require this surgery at a very young age. So, for any other queries, feel free to contact me. These are my details. And if you have any other queries, you can put that on the chat box. I'll be happy to answer that. So, till then, stay active, stay healthy, and take care. Thank you.